really excited to be able to speak with you tonight about our Diabetes 360 strategy and how it might, how you might help us advocate for it and how it might benefit you or those you care about who are living with or at risk of diabetes. I wanted to introduce myself. My name is Kimberly Hanson, and I'm the Executive Director of Federal Affairs with Diabetes Canada. I'm responsible for our advocacy with the federal government and on national issues, and I've also been leading the Diabetes 360 project for the last almost 2 years, and it's really a passion project of mine. I have been with the organization just about 2 years, and I have been living with type 1 diabetes for 25 years. So I'm really very committed and very honored to be able to work every day in support of people living with all forms of diabetes. And I'm really excited to share this strategy with you all tonight because I really believe it can make a difference in helping to prevent a number of cases of diabetes where that's possible, but also in helping those of us with the disease to live better and longer, healthier lives. What I'd like to do tonight, if this works for you guys, is I'd like to do a quickish walkthrough of what Diabetes 360 is. And I know that some of you on the line may have had some exposure to it. Some of you may be coming new to this project, and so I'm going to kind of try and talk to it as though I were in front of, say, my member of parliament, wanting to let them know for the first time what this is and why our government should support this. And so if you're thinking about advocating or speaking out on behalf of Diabetes 360, whether it's through sending emails or whether it's through meetings, this is kind of the way that I would suggest you consider speaking to it. And then after that, I'll share some tips and some requests for you in terms of how I would love it if you could help us advocate for this strategy, which I believe will help so many. Diving in, what is Diabetes 360? Well, it's a nationwide strategy to address the diabetes epidemic. Even though diabetes is growing in Canada at a rate of at least 40% per decade now, and even though Canada is in the worst third of developed countries in terms of the prevalence of diabetes and the cost of treating it, we have had no coordinated plan, no national strategy, no action plan in place since at least 2013, and that one was judged by the Auditor General as not having worked very well. So there's a real gap, and the problem's getting worse by any measure. It's really time for coordinated action, and so that's what Diabetes 360 is about. So let's focus a minute on why we need this strategy. And I'll direct your attention to the upper left-hand side of the infographic, the section entitled Every 24 Hours. And so what you can see here is that it is true today that in Canada, every single 24 hours, more than 20 Canadians die of the complications of diabetes. And that's actually a number we consider to be probably significantly underreported. 620 people receive a diagnosis of type 2 diabetes every day in Canada. 14 have lower limb amputations, most of which could have been avoided with better care and earlier detection. And our healthcare system spends $79 million treating diabetes. In total this year, our healthcare systems will spend $29 billion in direct healthcare costs associated with treating diabetes, which is clearly unsustainable. So from a human cost perspective, from an economic cost perspective, and from the perspective of the burden on our healthcare system, this situation cannot continue. We have to do something bold, and we have to do something urgently. So we're saying that is a coordinated framework. That framework is Diabetes 360. And so now I'm going to refer to the bottom band of the infographic. Diabetes 360 was a strategy developed by 120 stakeholders from all across Canada There were academics, there were patients, people living with diabetes, there were healthcare providers, there were researchers, there were companies that provide services to people with diabetes or devices, supplies, all bringing their expertise and their diverse perspectives on the burden of diabetes in Canada to the table. We followed a model that has been used very successfully in the case of HIV/AIDS, that was called, in their case, the 90-90-90 target. That target was set by the UN AIDS organization in 2014, and amazingly, every country in the world was able to choose whether to sign up or not and how to implement that target in a way that was relevant and meaningful to that country. But many, many countries around the world have done so, and largely because of that effort, recently HIV was listed as no longer having epidemic status in the world. People are now able to live very full, very healthy lives, even with the HIV virus. So it's really been a tremendous success in the case of that disease. And so we sought advice from some of the architects of that target for the HIV/AIDS community and borrowed from their lessons learned and sort of what really worked for them and learned from what didn't work for them as well, and sought to replicate it for the case of diabetes in Canada. And really what that meant was that we took a multi-sectoral or multi-stakeholder kind of approach to developing it, as I mentioned a few minutes ago. And everything in Diabetes 360 is designed to drive towards improved patient health outcomes, and everything is designed to be able to be measured as doing so. And so if any programs are not delivering benefits in terms of patient health outcomes, then they should be adjusted so that they do, or perhaps sunset if they can't. So with that in mind, this group of 120 stakeholders worked together over the course of the majority of 2018 to develop the Diabetes 360 framework and a whole host of recommendations for how these targets ought to be achieved. So Diabetes 360 consists of 4 targets: prevention, screening, treatment, and outcomes. We started out, as I said, trying to emulate a 90-90-90 target, which was around screening, treatment, and outcomes in the case of HIV/AIDS. And we really quickly realized that because of the nature of diabetes and because of how many complex risk factors there are in everyone's day-to-day environment that contribute to the development of either type 2 diabetes or its complications, we really had to add what we called a 4th 90 on prevention, on primary prevention, helping people to avoid developing the disease in the first place. And so 4 90s is 360, and we thought that the circle motif was nicely in line with the international symbol of diabetes, the blue circle. So Diabetes 360 was born. When we have implemented Diabetes 360, we will have 90% of Canadians living in an environment that prevents the development of diabetes, an environment that's conducive to wellness, where they're able to eat healthy diets, they're able to get regular physical activity, people are not living with poverty and food insecurity, where healthy living is taught from an early age. Then 90% of Canadians will be aware of their diabetes status. They will know whether they have diabetes or whether they're at risk of developing it. They're living with prediabetes or at risk of developing either prediabetes or diabetes. Right now, we know that 1 million people in Canada are probably living with diabetes and don't know it, and another 6 million have prediabetes, many of whom don't know that. So there's really a large group of people who are unaware of their diabetes status. And we know if we make them aware as quickly as possible, we can help prevent as many as 60% of people with prediabetes from going on to develop type 2 diabetes for up to 20 years. So it's really worth doing. The third target is that 90% of all Canadians with diabetes are engaged in preventing complications. They're engaged in appropriate interventions to support their health. And so those interventions are a combination of getting access to the right health care from the right provider at the right time. It's also getting access to the right medications, devices, and supplies that we need to manage our diabetes well. And it's having the right kinds of community and social supports to enable us to kind of do the difficult work of living day after day after day with a chronic disease. And so there's many, many recommendations supporting that target, as you might imagine, and really important gains to be made there in terms of improving the care that people with diabetes are able to access and are able to provide themselves. And then all three of those targets drive towards the fourth, which is that 90% of all Canadians with diabetes are achieving improved health outcomes. And so those improved health outcomes might be that they have lower average blood sugar readings, or that they have better cholesterol profiles, or better blood pressure readings. It will be at a population level that will have fewer complications like kidney failure or blindness or amputation. And it will also be, importantly, that people will have a better sense of well-being living with diabetes. So it's not enough that my lab work is coming back better. I have to be feeling like I'm feeling good living with this disease as much as is possible. That's an important measure of health outcome as well. So as I mentioned, there are about 36 specific recommendations that will drive towards us achieving those four targets. I won't get into the depths of those tonight during this call, but if you're interested in learning more about them, I would refer you on our website to the full report, which is the full 43-page document that outlines the strategy and all of the research that supports our recommendations. If you'd like the Coles Notes version, that can be found in the executive summary document, and it will list all of the recommendations that we have in support of these targets. We've done some digging and found that we strongly believe that if we implement this strategy, we can generate $20 billion in savings in just 7 years. So why did I pick 7 years as opposed to, say, 10 or a nice round number? Well, in order to implement the Diabetes 360 strategy, we're suggesting that the federal government needs to create a task force that's a kind of a center of expertise to work with each of the provinces and territories to support them in identifying what a Diabetes 360 strategy might best look like for their province. One province might have a real need in the area of screening, where another one has a real need to enhance the drugs listed on their formulary, for example. So it won't look the same the way it's implemented across the country. And that's by design, just the same as with HIV/AIDS. Each country approached implementing that target in a way that was meaningful to them, and it helped the whole world achieve the target. So this task force or nerve center, we think, needs to be created for a period of 7 years. We think that that's about the amount of time that it would need to make its recommendations, to work with the provinces and territories, help them to implement the measurement of patient outcomes, the sort of data foundation that would be needed, to help them institute a process of continuous improvement so that all of their patient care programs can continuously renew based on how they're improving patient health outcomes. And then that task force would work itself out of a job. It would be designed to imbue all of its expertise within the healthcare infrastructure and social infrastructure, frankly, in many of the provinces and territories, and then work itself out of a job. We think that work would take 7 years, and we think it would cost $150 million that we're asking the federal government to dedicate. that work over those 7 years could result in $20 billion of savings. And the way that we calculate that is it's a bit of I will acknowledge up front that these are rough estimates because we don't have a good foundation of data in Canada right now to tell us even exactly how many people there are with type 1 versus type 2 diabetes, let alone what's the total burden of diabetes and which programs are working well in support of it. But there's research that is peer-reviewed that supports all of the assertions that I'm about to make. And if you're curious about the science behind the numbers, I would point you to the document of that name on our website, which gives the explanation for how we come up with all these numbers and cites the research that proves these assertions. And so these are sort of blunt numbers, but actually they're not only are they not inflated, they're likely significantly underreported. So in 7 years, we would have, with Diabetes 360 being implemented, 770,000 fewer cases of type 2 diabetes diagnosed. We'd have 110,000 fewer every year. We would therefore have 245,000 fewer hospitalizations across the country and 34,000 fewer lower limb amputations, which is, I get goosebumps every time I think about that figure. Each of those things costs a lot of money, as you might imagine. And so there would be significant, about $11 billion worth of reduced costs for the healthcare system in terms of these hospitalizations and these amputations and treating these new cases of diabetes. So that's a pretty big gain. Then there's an additional $9 billion in benefits that would accrue to employers and to Canadians themselves who are able to be more engaged productively in the workforce, who aren't needing to take sick leaves and have absences from work, and who aren't needing to draw on health benefits quite as much. So it's really, I've heard it said by a number of parliamentarians I've talked to, and I'm glad to hear them say it because I really agree that implementing this strategy is absolutely a no-brainer. It's completely unacceptable for us to leave the epidemic the way that it is right now. We must take focused, concerted action, and this strategy is supported by the entire diabetes community in Canada and will make huge returns on investment really quickly. So, how are we advocating for that $150 million of federal funding? Well, we've been working really hard, and with many of the people that have been involved in the strategy right beside us, some of whom I imagine are on the line tonight. We've been reaching out to parliamentarians and bureaucrats, advocating that Diabetes 360 receive funding. We were gunning really hard for Budget 2019. We really wanted to get the money as quickly as possible so that we could start to bend the growth curve of this disease, and also so that we'd have something that we could all be really proud about in 2021 when we'll celebrate the 100th anniversary of the discovery of insulin in Canada. We did not get funding in Budget 2019, and so we sought a bunch of feedback on why not. And we heard from people in the Minister of Health's office, people in the Prime Minister's office, that there's lots of support for our strategy and it just wasn't our turn yet, and there's lots of reason to be hopeful that we'll receive funding in Budget 2020. Well, that's all well and good, but we need to keep pushing in order to make sure that we are there in 2020. We can't let up the pressure by any means. And that's really where you guys come in. So in 2019, our focus is now on making diabetes and Diabetes 360 an election issue so that it will be in Budget 2020. And in order to do that, this summer, our big push is on getting signatures on a petition that we've launched. And you'll see that petition on our website, diabetes.ca/strategy. It's if you're looking on a mobile phone, it will be at the bottom. If you're looking on a computer, it will be over at the right. And so you'll see it's a fairly simple petition where we're calling on all political parties to commit to launching a diabetes strategy to prevent 1 million cases of diabetes and avoid hundreds of thousands of hospitalizations for diabetes-related conditions in the next 10 years. Basically, what we're saying is that we want every federal political party to commit to implementing a diabetes strategy in their platform. And I've been working night and day to try and influence them to put the strategy in their platform. But I need to have you guys speaking up and your networks and communities speaking up in support of it to make sure that the politicians know that this is critically important. The signatures on the petition will demonstrate to politicians that there's strong public support for Diabetes 360. And so we really need as many signatures as possible, and that's where you come in. We're hoping that you can consider signing the petition, obviously, yourself, that you will consider engaging your personal and perhaps professional networks to get people to sign, and that you will consider meeting with either your provincial elected official or your candidate for federal office once they all start coming door knocking, which should be any time now, and ask them to sign our petition. They should be able to. It's nothing that a politician couldn't sign in terms of the way it's worded, and asking them to ensure that their party supports Diabetes 360. At the same time, while this petition is out and while you hopefully are getting signatures from your communities, Diabetes Canada is going to keep working to influence federal politicians and political parties to put the strategy in their platform. And we're also going to be working at the provincial level with a few provinces that are more inclined to, or they're closer to considering developing a Diabetes 360 strategy of their own, which is, as I mentioned a few minutes ago, exactly how this is intended to work. So we're setting up for roundtables in Ontario, in British Columbia, and New Brunswick in early September to try and shape how a Diabetes 360 strategy might look in those provinces. And so in that way, we're trying to kind of apply pressure from, if you will, the top, the federal level, and the bottom, the sort of the grassroots level and the provincial level, to make sure that we meet in the middle with a Diabetes 360 strategy implemented as soon as possible. Then in late August, when the federal election starts in earnest, we'll kick it up another notch. We'll have a really coordinated social media campaign. We'll be reaching out to all of our volunteers, again, to encourage even more signatures. We're going to be trying to get diabetes talked about in any debates, public debates that happen of candidates during the election. We're going to have pieces in the media, in print media, on websites, blogs, everything. And you can contribute to that if you're willing. And all of those things will encourage candidates to tweet their support for Diabetes 360. It will encourage people like you to tell your personal story about how Diabetes 360, or how diabetes affects you rather, and help to really create that unified voice calling for this. So with all that said, what I was hoping that those of you on the line tonight would consider doing is, as mentioned, sign the Diabetes 360 petition on our website, diabetes.ca/strategy, if you haven't already. And please consider encouraging your personal and professional networks to do so. Maybe put up a post on Facebook or on Twitter or on LinkedIn, depending on which forum you use. And think about putting a post up maybe every week or two to remind your friends and your associates to sign the petition if they haven't yet. I even had to prod my mother, who's a great supporter of this, a couple times to get her to actually put pen to paper. And that's because we all know we have busy lives and summer's coming and people will be busy. But if you can encourage your networks to sign it and to get them to encourage their networks, that will really make a huge difference. As I mentioned a few minutes ago, please give some thought to whether you might feel comfortable asking for a meeting with your MPP or your candidate for federal office once they get started, and talk to them about how diabetes affects you and how a nationwide strategy might help your life. And so, how might a Diabetes 360 strategy actually make a difference for a person living with diabetes? I'd like to give you a couple of examples. If you are a person who is, for example, living in a semi-rural community, you might have some challenges getting to a doctor's office regularly, or maybe your doctor's visits are a little bit rushed because there are fewer care providers in your region, but you want to know whether you're at risk of diabetes. Well, Diabetes 360 will likely mean that screening clinics will be made available in your local community center or pharmacy or grocery store so that you can find out whether you are living with or at risk of diabetes. Say that you've just been diagnosed with diabetes and you're wondering what this means. How do you get advice, help? How do you learn how to cook? Well, there'll be a patient portal that will help provide you with access to resources such as support groups in your community, or fitness classes, or cooking classes. If you're a person who's, say, a newcomer to Canada, and perhaps English or French are not languages that you're fully fluent in, you'll be able to connect through that portal to resources that are available in your language in your community. If you're a person who's living with food insecurity and struggling to have as healthy a diet as you would like to in order to reduce your risk of diabetes or its complications, well, Diabetes 360 will be ensuring that we partner with other agencies doing work to end food insecurity through delivering subsidies for fruits and vegetables, through supporting food cupboards and banks, through helping support hydroponic facilities for fruits and vegetables to be grown even in northern communities. If you're a person who's got type 1 and you really want to have access to a continuous glucose monitor or the latest insulin pump or a new kind of insulin that's been, you hear from your friends is working really well for them but isn't on your provincial formulary, Diabetes 360 will be a framework for helping to level out the medications, devices, and supplies that are covered in each of the provinces and territories, and it will help support building up the base of evidence for how these devices and supplies really do help to improve patient health outcomes and therefore are worth governments investing in. So those are just a handful of examples, and they're really just scratching the surface of how things might be different if Diabetes 360 were implemented. But there's something in it for every person with diabetes or at risk of it, and it will help people with diabetes throughout the life cycle, throughout our journey through life with the disease. And so you can consider that, maybe familiarize yourself a bit with the recommendations and think about what these might mean to you and what you're struggling with the most or have struggled with the most in the past in terms of Diabetes 360, to be able to speak to your community or your candidate or elected official about how it could make a difference to you. Think about posting and sharing messages on social media to increase awareness of diabetes itself and Diabetes 360. You can also think about writing a blog or even an op-ed for a local publication. If you are on LinkedIn, you can post a blog there and share it with your network anytime you like. Some of you might have actual blogs, and you can write most papers or online or print media will take opinion pieces of up to about 500 words, and they love to hear from people who are in their own community. So do consider writing it up and speaking to why diabetes matters to you and why Diabetes 360 would help. And certainly, although we are by no means asking you to go out and fundraise, I would just be remiss if I didn't mention that we would certainly welcome individual donations to Diabetes Canada to support the advocacy work that we do in behalf of Diabetes 360 and all of the subcomponents of it. If that's something that the people that you're talking to express an interest in.